Asia appears to have managed the outbreak within the country. The World Health Organization has warned that the coronavirus is a long way from finished in the Asia-Pacific, urging governments to prepare for mass infections and warning of a renewed crisis in countries where the situation currently appears to be under control. Well, as we've been hearing, South Korea has been relatively successful at bringing it under control. So how big is the risk of a second wave? Well, let's talk to Dr. Jerome Kim, who's director of the International Vaccine Institute in Seoul. Dr. Kim, thanks for being on the programme. Give us your take on the success seen in South Korea, because in the early days of the reporting of this pandemic, there was a real fear at how quickly it was spreading in the country.
In part, can be attributed to the MERS outbreak that occurred here, the Middle East Respiratory Syndrome outbreak that occurred in 2015. That had actually allowed the government to understand what its failures were, to put corrective action and new laws into place that allowed a more effective and clear response the second time. So, starting at the top of the government with preparation, and then having, a very clear spokesperson giving very simple and direct instructions with the authority of government, all very, very important, clear, simple, unified messaging. And then, the policy of massive testing, isolating those who were infected, tracking down people who might have been exposed, and treating those who were infected, was the policy that eventually won the day. But as you point out, very rightly, this is like a forest fire that has passed through an area. You may be out of the fire for now, but it only takes one ember to start the whole thing over again. So, the government has to use this time, to prepare, to rest, to, try to identify the things that they need to do better, and really to set up the kind of strict surveillance system that allows the government to identify and jump on new outbreaks. And so, for instance, we're seeing now, and we've had colleagues delayed at the airport because all new entries from the United States and Europe have throat swabs done to test for coronavirus, and then are put in a government hotel overnight until their tests come back negative, and then they're on mandatory 14-day quarantine. And every day you get a little text message that asks you how you're feeling and if you're having symptoms consistent with coronavirus. But these are the kind of data-driven decisions, decisions made not out of emotion, but based on where the new infections are coming from, that you have to do when you're responding to a pandemic threat like COVID-19.
Given what you've just said, are you concerned about how this is being tackled in Europe then and the US, where such strict surveillance isn't perhaps in place? For example, I'm hearing anecdotally from many that when they come through Heathrow Airport, one of the busiest in the world, there's hardly any testing going on or even surveillance of anyone. They're coming and going.
So again, it's difficult because the United States and Europe are actually playing a game of catch-up at this point. I mean, the key here is that the United States has rolled out a massive testing program. I think probably they're at 1 million tests so far. And they're just beginning to uncover the depth of the problem. And you can see that in some of their mortality statistics, which have dropped down to the level which is similar to what's seen in Korea, suggesting that the testing regimen is now up and running and is functioning as it should. The United States and Europe have resources at their command. They have modern, advanced economies. And many of us are worried not about the United States and Europe, but what's happening in low and middle income countries.
Absolutely. Sorry to interrupt you, but absolutely, that is a huge concern. Those countries that are seeing it spread now, where they have not got the resources or the health systems in place to cope. But just get back to the other issue of a second wave. You were saying, the South Korean government must rest and pause. What's your thinking in terms of a second wave, not just in South Korea or China, but in other countries?
So this is where those of us who do vaccine development are very eager to start the development and testing of vaccines, because this second wave, really there are over 1 billion uninfected Chinese. There are 50 million uninfected Koreans. As we look at where the epidemic has been and has been relatively successfully controlled, we still have a very large population of people who are naive, who haven't been exposed to the virus, who don't have protective immune responses. And for this reason, Korea is still under a, social distancing policy that is not mandatory, but is, very strongly encouraged from the highest levels of government. We're not back to normal. And, in order for the world to resume its economy, in order to have normal social interactions with people at work or with your family or with your friends, we're going to need a more permanent solution than social distancing and flattening the curve, which really delays. It's really a temporizing measure.
Okay. I'd love to talk to you further, but sadly we haven't got the time. But thank you so much. We appreciate your expertise here on BBC World News. Fascinating. And of course, so much more detail on our website as well. Stay with us here on BBC World News. Still to come.